500,000 Americans file for bankruptcy every year because of medical bills, while healthcare companies still report strong profits. How can a system be this harsh on families and still look successful on paper? For years, people were told the same story. Get a job with benefits, keep your insurance active, and if something bad happens, the system will protect you. That promise feels broken now. One hospital visit can lead to months of bills, calls from collectors, and a damaged credit score. Have you or someone you know ever opened a medical bill and felt real shock and fear? Tell your story in the comments, because more people are living this than you think. Think back to the biggest medical bill you have ever seen. In the comments, write two numbers side by side, what you expected to pay and what the bill actually showed. Seeing those numbers together helps people realize this is not a you problem, it is a pattern. Medical bankruptcy is not rare. It is one of the main reasons Americans lose financial stability. In this video, we are going to break down why medical bankruptcy is still the #1 reason Americans go broke, how people get trapped even when they have insurance, and what you can do to lower your own risk. The first problem starts with insurance itself. Most people think, I have coverage, so I am safe. But many modern plans push more and more of the cost onto you. Deductibles keep rising. Some families must pay several $1,000s out of pocket before their insurance even starts to help. Even with employer coverage, average out-of-pocket spending has climbed sharply. So when someone lands in the emergency room after an accident or sudden illness, they find out too late that their safety net is full of holes. Has that ever happened to you, where you were sure something was covered, then got hit with a big balance? Let us know below, because your story can warn someone else who has not faced it yet. Once that first large bill lands, the hidden avalanche begins. The main hospital bill is followed by smaller ones from labs, radiologists, and outside specialists you may not even remember seeing. Each one has its own code, its own due date, its own phone number. To stay afloat, people pay with credit cards, borrow from savings, or take small personal loans. These debts do not show up on health charts, but they do show up on credit reports and in daily stress at home. Many people who end up in medical bankruptcy actually had insurance when they got sick. They did what they were told. The problem is the fine print and the billing maze. An anesthesiologist might be out of network, even though the hospital itself is in network. Claims get denied on technical grounds. Errors appear on bills, but you only catch them if you ask for an itemized copy. A family may get through the illness itself, but months later, they are still fighting paperwork. Have you ever had a claim denied in a way that felt confusing or unfair? Share what happened in the comments. The more examples people see, the less they blame themselves. Then there is the second hit, losing income. A serious illness does not only raise your expenses, it also attacks your ability to work. Someone going through chemo, recovering from surgery, or caring for a sick child often cannot keep a full schedule. Many people who file for medical-related bankruptcy also lost income while they were sick. You cannot pay large bills without a paycheck. If your job provides your insurance, losing that job can also mean losing your coverage. Do you think most employers give enough support when workers face a medical crisis, or do they quietly look for a way to move on? Drop a short answer, supportive, or cold, so we get a quick snapshot from real workers, not press releases. Older Americans are hit especially hard. People in their 50s and early 60s are often too young for full Medicare benefits, but old enough to have more health problems. Many drain retirement accounts, take second mortgages, or sell their homes to cover medical costs. Others cash out retirement plans early and get penalized for it. Healthcare costs have risen faster than wages, so even steady workers feel like they are running uphill. This problem damages whole communities, not just individuals. In many rural areas, hospitals have closed or cut services. That forces patients to travel farther, pay more for gas, and deal with fewer care options. In cities, insurance networks get narrower every year. You might live near a major hospital, but if it is out of network, you are treated like you live hours away. When people delay care to avoid bills, they often end up back in the system later with worse conditions that cost even more to treat. Have rising medical costs ever made you cancel or delay a visit you knew you needed? Be honest in the comments. When you say it out loud, you give other people permission to admit the same thing. Here is a small challenge for this week. Keep every medical-related letter, email, or bill that arrives. At the end of the week, count how many you got, even if some were just statements. Then come back to this video and comment with that number. You will see how many others are dealing with the same constant drip. Even smaller medical debts can follow people for years. Once a bill goes to collections, it can drag down your credit score. That makes it harder to rent a place, buy a car, or qualify for a normal loan. Some recent rule changes keep certain medical debts off credit reports, which helps a little. But for millions who already suffered the damage, that relief arrives late. There is also damage you cannot see on paper. Medical debt brings constant worry, lost sleep, and a sense of shame that should not exist. People start thinking twice before going to the doctor, even when they know something is wrong. For many adults with medical debt, the choice is simple and cruel. Risk more bills or live with the pain. Some doctors and nurses are speaking out as well. They see patients choose between treatment and rent, between medicine and groceries. Medical workers are trained to heal, but many say the financial side of the system keeps hurting the same people they just treated. If you work in healthcare, drop one thing you wish patients knew about bills or financial help. There are early signs of hope. Some states and cities have started buying up old medical debt from collectors for very low prices, then forgiving it for residents. Certain hospitals are testing clearer pricing before care, instead of surprising patients afterward. Others have charity programs or hardship policies that reduce bills. The problem is, these programs are often hidden in small print, and people do not know they exist. Still, most reforms so far focus on who pays the bill, not why the bill is so high in the first place. Insurance might cover part of the cost, but that does not explain $1,000 ambulance rides or basic drugs with huge markups. In your view, what needs to change first? Hospital pricing, insurance rules, drug costs? Pick one and write it in the comments. Even in a broken system, there are steps that can help you lower your risk. Always ask for an itemized bill and look for errors. If you get a large balance, contact the hospital before it goes to collections and ask about financial assistance or payment plans. Non-profit hospitals are often required to offer some form of help, but you usually have to ask directly. Never ignore a medical bill. Even small regular payments can sometimes keep it from turning into a collection problem. If someone you care about is drowning in medical debt, think of them for a second. When this video ends, send it to them directly. Then come back and type "shared" in the comments, so they know they are not the only one fighting this battle. Because at the core, this comes down to one simple belief: getting sick should not mean going broke. Yet it keeps happening to hundreds of thousands of families every year. The story of medical bankruptcy is also the story of how fragile normal life really is in America. If you want to protect your future and understand what is really driving America's hidden debt crisis, stay close to this channel. Hit like if this helped you feel less alone. Subscribe and turn on notifications so you do not miss the next breakdown. And before you go, tell us in one short sentence what scares you most about medical bills. Reading each other's answers might be the first step toward fixing a problem that none of us were meant to carry alone.